picking up. One of the things I really want to make sure we get to is things like how to, when someone starts to get a chest infection, how to keep the secretions thinner so that it doesn't deteriorate. So can we go to, what do you guys do when you first start to sense there's something coming on? Can
I say that I think you really need to go right back to the start, and I think you need to have a plan. I think you shouldn't just treat this randomly. You need to sit down.
We should all have a respiratory protocol for our children.
Well, I called it a plan, but a protocol. Yeah, a protocol, plan, call it whatever you like. If you can sit down and ideally with a respiratory consultant, get your GP involved, get your, if you have a chest physiotherapist, get her involved, get everybody involved, to sit down and work out what you're going to do, preventative wise and active, if how to prevent and how to treat an active chest infection. Claire has a traffic light system, green, amber, red. And this is particularly important when people are either in respite care away from home or they're in residential care, even more important when they're in residential care with all the changes of care workers and whatever. Things can happen really quickly with our Rett people. They can change really quickly. So they have to be on it. They really have to know what they're doing. And I think that to have this written plan that and a simple, keep it as simple as possible, so everybody knows what to do at the various stages, really. And I think, everything that we've talked about needs to come into that.
Yvonne, can I just ask, for the sake of, or Sam or Melise, for the sake of, those of us who aren't dealing with these issues yet, or for someone who is maybe at the very, very start, what does the protocol look like? I mean, what is your protocol? Just so we've got an example and a model of, how are you dealing with this on a preventative level, and then
right. So
hopefully it's a lot like what's in the health checklist.
It is, yeah. I mean, I just quickly run through it. Use of a prophylactic antibiotic during the winter months. We use carbocysteine, which is something that you may or may not think is useful, but that keeps the secretions fluid. Back again to don't let them clog, don't let them get thick. Keep them moving. That makes them easier to cough up. However, once you've got to that stage, if you've got a weak cough, then what do? Well, maybe you need to use a Yanker suction, not a deep suction, but maybe you need to add in a suction machine. Another preventative, if coughing is becoming very frequent, observe and take the temperature frequently, because often our people have a low temperature. So if it starts creeping up, that's the sign possibly there's an infection coming. If the temperature is raised, if people start to get worried, that's when you call in your chest physiotherapist or your GP.